Zero sa computation. Ay, isang zero. Yung conversion. Tinignan ko pala, sabi ko, alam ko may something, may add dito eh, may multiply dito. Zero,
Dapat
sabi ko na
sinilip
lang.
nyo na. Kasi di ba remember days before, sabi ko, shucks, naka-Fahrenheit pala yung temp doon. Sabi ko, hindi ko alam yung Fahrenheit. O, di ba? Meron
Pag naririnig ko nga
advantage.
naririnig ko si Klimek na nagsasalita about yung ganyan eh. Ni-skip ko na lang. Next na nga lang.
Ayan,
Babad talaga eh.
Wait lang, anong
Ayan,
conversion nito?
Kasi nakikita pala yung sagot ko. Next time, kagandahan ko yung sagot ko na.
Oo, lumalabas lahat, no? Pati yung date submitted, mga ganyan. Kaya namomonitor. Ayun. Sige, so start na po tayo, ano? So,
sige lang.
Okay.
Sige po. So, number 1 question. Ay, wait lang po muna pala. So, most of you, I mean, out of 35 items, dapat ang makuha natin para makapass tayo ay 30. Ganon. So, kasi out of 75 questions, para mag-stop tayo by 75, di pa dapat makakuha tayo ng 60 na correct answer. So, ayun.
So, ibig sabihin ni Catherine, lahat tayo bagsak.
Ay, pumasama sa una. Saka lang ako bumagsak. Gusto ko lang
Pag
talaga
NCLEX
i-point
to,
out
lahat
yun.
tayo bagsak. Yun
Ipo-point
eh.
out ko talaga
Hindi, pag
yun.
NCLEX to, hindi siya magsastop
Kaya
sa
nga,
75. Dire-diretso ang questions natin.
Hindi. Dire-diretso. Oo, tama. Saka ano naman, ang nangyayari naman kasi sa NCLEX, di ba meron cut system siya eh, di ba? So, kapag kunwari wrong mo kapag wrong mo yung isang item, for example, parang automatic siyang mag-generate ng mas easier na item para masagot mo. So, very important din na dapat meron tayong educated guess. Ganyan.
Dapat pala hindi masyadong ginagalingan, my friends.
Why does that sound so, hindi dapat masyadong ginagalingan?
Look where my bida-bida skills got me. I'm suspended.
Ayan.
Para malaman kung pasado. Pag mahirap, pasado. Pag madali, baka bagsak.
Sige po, start na tayo. So, number 1 question, which of the following is an appropriate nursing action when implementing standard precautions? Nag-item analysis po ako. Parang from items 1 to 10, most of you got it correctly. And, wait lang. Generate ko lang yung para makita natin kung saan po mostly nagkamali. Sa number 1 item, most of you got it correctly naman po. Ang answer nyo ay letter
A.
Letter A, yes. Okay. Consider all body substances potentially infectious. Bakit nga po itong answer natin? Dahil?
Wala palang explanation. Last! Tag team.
And, kasi, di ba, standard prec na yung ganyan.
Standard ka na kahit anumang case ng pasyente natin, we should consider it as infectious. Kaya, yun.
Okay.
Ayun.
So,
most of you got it. And maganda rin na sa next na review question. After answering yung per item, dapat meron kayong rationale para mas mag-stick po sa mind. Yun. Kasi maraming Funda concepts sa NCLEX. And yun nga, ang update din talaga ngayon, may mga research questions na rin. Ayun. So, wala naman pong question dito, ano?
No question.
Wala naman po.
Okay. Number 2, which of the following clients would qualify for hospice care? So, when we say hospice, ano nga pong ibig natin sabihin doon? It's more on palliative, di ba? More on mga end-stage care. So, this is, most of you, all of you got it correctly naman. So, letter A. Yan. Bakit hindi yung left side? Siyempre, hindi naman siya pang din. More on sa metastatic cancer talaga siya. Okay? No questions naman po, ano? Number 3. isa pang term pala for hospice, 'di ba, yung ginagamit nila is usually mga terminally ill, mga ganun, or palliative, yun yung mga terms
Yeah.
na ginagamit nila for that. Number 3, for a hospitalized client, which statement reflects appropriate documentation in the client's medical record. So, upon checking po, yan, all of you got it correctly din naman po. So, I think wala naman pong question dito, no? So, what is the rationale behind, for this question? Syempre, kapag nagdo-document tayo, hindi tayo nagbe-base dun sa opinion, di ba? We are not basing on conclusion. We are basing on the facts, or yung very accurate, yung mga objective data natin, subjective data, but we are not giving any conclusions or interpretations dun sa mga assessment natin. Ayun. So, the answer is
I think I got this incorrectly.
ano po?
Mali ako dito. Mali ako.
Number 3, wait lang.
Mali ako dyan eh.
Ayo, anong answer nyo nga po dyan? Parang answer mo ata dito.
Pinili ko yung small pressure ulcer noted at the lower back.
Yan nga ito yung sagot, diba? Letter C.
No, it's D.
No. Wait lang. Bakit lumalabas dito sa item analysis na correct? Wait.
Baka yung unang take. Hindi eh. Yun talaga yung pinili ko eh. Yung basta nung nilabas yung scores kanina, letter D yung answer, skin moist and cool.
Yun yung sagot? Yun yung correct answer?
Yun yung nakita ko kanina dun sa sinend ni Madiamst.
Oo. So, ang correct
Why not?
answer dito ay letter B. Bakit? Kasi, yun nga, sabi ko kanina, our documentation should be factual and accurate. And, nagbe-base tayo sa ITPA, di ba? Yung inspection, palpation, percussion, and auscultation. And kung ano yung naamoy natin, di ba? Based on senses. Based on kung ano yung na-feel natin, kung yung patient ba ay warm to touch, or, di ba, cold and clammy skin. Yun usually mga, di ba, yung nasa charting natin yon. And, eto, bakit hindi letter C? Kasi, documentation of ulcer should include the exact size and location. So, if you're going to notice yung letter C, anong nakalagay?
Lang siya? General lang siya.
Okay, so small pressure. So, you should say like full thickness.
Yes, oo, mga ganun.
Parang
So,
ganun.
dapat
Ulcer.
i-specify yung exact size. Kasi gaano ka small ang small, gaano ka big ang big, mga ganun.
Yeah.
Yun,
Hindi ko na
ganun
alam.
po.
Yeah,
So,
okay.
So, as mentioned earlier, our interpretations, conclusions, or opinions should not be documented. So, kung nakita natin na ito, a client had a good day, ganyan. So, kung makita ng yan, na ganyan yung charting, tatapon na yan, mga ganyan. Seems to be mad at the physician. Parang it's not appropriate naman na ilagay natin sa documentation. So, it's merely on the assessment and based on ITPA. Yun po. Okay?
Alam ko na kung bakit mali ni Jessica yan.
Ha?
Alam ko na kung bakit mali ni Jessica yan.
Yun sama mo. Hindi. Nung nakita ko yung answer, sabi ko, I realized. Kasi kailangan sabihin mo kung anong grade ng ulcer na nakita mo.
Di ba reflection yan kung paano mag-charting sa hospital? Tumawa. Guilty. Anong oras nagsasara ng chart? Anong oras?
Hoy! Excuse me.
Anong oras?
Hindi yan realistic, ha? With the ratio, ha? Huwag kang
Kaya actually,
kailangan
diba,
start
sabi
na
dun
shift
sa...
na close na.
Basta stable yung pasyente, huwag ka magulo.
Yan tuloy.
Kaya nga actually, para hindi po tayo malito lagi, we should always base on what is standard, what is normal, and based on the book. Ito po is based on Saunders talaga eh. And yun din kasi yung sinuggest sa akin nung mga friends ko na nag-take ng NCLEX. if you're going to start to review NCLEX, start ka sa Saunders. Ganyan. Tapos, may mga binigay siyang link sa akin, yung first review. Kaya kung mag-MS po kayo, magandang itry nyo po yung first na, na link. May mga free questions kasi yun
Excuse me.
na nalalabas. So, mas mare-review din po kayo. Ayun.
Okay.
So, wala na pong question, ano? Number 4, the nurse will administer the client's 9 a.m. medication. The client is away from his room for ultrasound of the liver. Which nursing action is appropriate? Okay, so have the client keep that. Ask the client's relatives to keep the medications for the client until he returns. Lock the medications in the medicine prep area until the client returns, or leave the medications on the drawer of the client's bedside table. So what is the best answer here?
C.
Okay, so the answer is letter C. Okay, so bakit po ito? The nurse must put the medicines in the secured area. Okay, and hindi po dapat natin iwan yung mga medications sa bedside. Okay, so for example din, nasa bathroom, may mga ganon din kasing questions nasa bathroom yung pasyente. So anong gagawin mo? Ibibigay mo lang sa significant others niya, or kukunin mo muna, and then babalik ka na lang. So, syempre, ang gagawin mo is kunin mo na lang muna, balik ka na lang pag ready na siya. And you should not leave the area or yung room ng patient kapag hindi niya na-consume yung required na dosage or yung required na medication. So, dapat na-consume niya yon before leaving the area. Okay? So, number 5, the nurse is caring for ano lang po kayo ha, kung may question kayo. The nurse is caring for a client receiving PCA for pain management. So, which statement about PCA is true? Ayan. So, what is your answer?
Letter B.
Okay, so number 5 is letter B. Okay? So, syempre, 'di ba, ang PCA nga natin is from the term itself, I mean from the word controlled, 'di ba? So, nagkakaroon na tayo ng idea. So, isang test taking strategy din po 'yon na we should really look into the different yung mga terms na nandun sa question. Kasi once na makita mo pa lang yung question, 'di ba, parang ang malalaman mo na alam ko na kung anong answer dito. Para kung ano yung hinahanap dito. And lalong-lalo na po, 'di ba, sa NCLEX, meron silang test banks. So, kapag lagi po nating nakikita yung mga question and lagi nating ina-answeran, kahit na-answeran mo na siya before, parang mas mapa-familiarize tayo sa ganong question. Okay? So, in addition, the PCA pump also allows for continuous infusions of the medication. And in here, the client may still experience complications, okay, ng medication. And sino yung nag-order nito? Of course, it is the physician who prescribes the medication order for this. Okay? Number 6, an antihypertensive agent, minoxidil or yung Lonitin, 5 milligrams per RM is ordered. Stock on hand is 2.5 milligrams per tab. Okay, so how many tablets should be administered? Okay, so very easy. Paano po ang ating computation dito? Ang computation natin dito ay yung most of you got it correctly naman. I mean, all of you got it correctly naman. Which is yung answer natin ay
2 tablets.
okay, 2. So, ang ano natin dito, yung ano ang ating formula for this? Ma'am Jess?
Paano ba yan? Stock overdose. Sorry lang. Oo, stock overdose pala. Sorry. Tama ba?
Okay.
Parang mali yung sinabi ko. Ay, required pala. Required.
Oo.
Divided by,
Divided by kung ilan
by
yung
stock. Yun lang. Wala kasing volumes.
Oo. So, yun lang po ang ano doon. Dapat alam po natin yung yung formula. And number 7, the expectorant guaifenesin or robitussin 300 milligrams per RM has been ordered. The bottle is labeled 100 milligrams per 5 ml, and how many ml should be given? So, the answer is
15.
15. 15 ml.
Okay. Yes, 15 ml. So, what is our formula for this? Kuya Jack?
Yung formula talaga tinanong sa akin.
Kasasabi ko lang eh, parang ano naman to eh.
Yun, whatever Jessica said.
Oh,
Ano nga?
halatang hindi nakinig.
Sorry. May kinakalikot kasi ako dito. Sorry.
Dapat naka-on yung cam.
On cam ba?
Kaya halatang hindi nakinig eh.
On cam ba? On cam na daw, on cam.
Hindi nakikinig pala. Hoy, formula!
Formula.
Basta yun. Huwag na ako tuloy ng formula. Seryoso, wag.
Sabihin mo, divide. Divide, tapos
Kainis tong mga to.
Go, Kuya.
Ano lang, Wisit!
Kahit hindi wag-cam, obvious eh.
Sama ng mga to. Pass ako. Call a friend, JP.
Sige, Sir JP. Ano yung formula natin for this? Yung desired natin ay 300 milligrams.
300
Ay,
milligrams.
I
Yes,
mean
and
yung,
stop it.
yung order. Oo.
Tapos over 100 milligrams because that's the stop.
Per 5.
So cancel milligram. So that's 3 times yung 5 ml. So leads you to 15 ml now.
Okay, so our formula there is desired dose divided by stop times yung dilution. Yun. Okay?
Oh, yun
Number
pala, dilution.
The physician's order reads administer D5LR 3 liters for 24 hours. Okay? Dapat dalawa po yung answer nyo dito. Letter A, to how many drops per minute will you regulate the IVF? And letter B, how many ml per hour will be infused? So, letter A, paano po ang computation natin? How many drops per minute?
Ito, nagkamali ako sa drop factor nito.
Mm-mm.
So, 3,000 liters
Okay.
multiplied by the drop factor.
Mm-mm.
20 ata yung ginamit ko. And
20.
then divided by 24 hours times 60 para maging over minute siya, para makuha yung drops per minute.
Mm-mm.
So, 20 ata yung ginamit ko kasi 20 yung drop factor ng mamacrosit sa ospital.
Ayun. Yun nga din po. Standard po pag sa NCLEX is we're going to use this standard drop factor which is 15.
15.
So, may mga ibang institutions kasi like I think sa Benguet Gen 20 rin ata 20 rin ata yung drop factor na ginagamit nila doon eh. Kaya yun. So sa NCLEX po we're going to use the drop factor na 15.
Okay,
Ayun.
gotcha.
Okay. So kapag 15 po ang ating drop factor, paano po ang computation natin yan? Volume, nagte-take down notes po kayo. I suggest that you should have your own notebook for this, and lalong-lalo na kapag nag-answer kayo ng questions tapos lumalabas na agad yung rationale para at least hindi niyo po makalimutan. Kasi mas mataas ang retention din kapag nakikita nyo, nababasa nyo tapos sinusulat nyo. Ayun. So what is our formula for this? Our formula is volume in ml or volume in cc times the drop factor. Okay, so in this example, that is the volume in cc na given.
3,000.
Okay,
This
so
is
Okay,
3,000.
3,000 ml times the drop factor, which is, ano yung sinabi ko po kanina?
15.
Constant
Okay,
is
okay,
15.
15. So, which gives us, ano po yung product? I mean, ano yung product niya?
45,000.
Okay, 45,000. And then, di ba, 45,000 cc. And that is equivalent now to drops per minute. Okay, so, ang gagawin po natin dyan, we're going to
Divided by the hours.
multiply. Yes, divide it, di ba? So, 60,
Ay, mali pala.
ilang hours po siya to be infused for 24 hours, right? Okay.
1,440.
Okay, so 60 times 24 hours, that gives us a total of 1,440. Okay, so 45,000 divided by 1,440, and that gives us, ilan po? Ilang drops?
31.25.
31.
31
Okay?
rounded off. Yeah.
Yes. 31 drops per minute. Ayun. So, ganun po siya. And for letter B, how many ml will be infused? Ilang ml po ang may infused
125.
per hour?
25 ml.
Okay, so what is our formula for that?
Volume
Total
divided by total volume divided by
number
the
hours.
Okay.
Hours.
time of infusion.
Times the number of hours. And that gives, yan, very easy po, no? Volume times yung number of hours na, which gives a total of 125 ml per hour. Okay? Number 9, eto na. Okay, number 9, 38.3 degrees Celsius equals how many degrees Fahrenheit? Okay? So, sino bang
Ako na.
mga...
Memorize ko yan.
Sige. Sige.
For degree
Sige,
Celsius
go.
to degree Fahrenheit. So that's degree Celsius multiplied by 9. Then divided by 5 plus 32 to get to your degree Fahrenheit. So if that's 38.3 multiplied by 9. Ay, saan yung calculator ko? So that's 344.7 divided by 5.
Kaya pala ako mali.
So that's 68.94. Then you add the 32. So 100.94 degrees Fahrenheit.
So, may shortcut din po dyan, ano? So, 38 degrees, 38.3 degrees Celsius times, i-multiply nyo lang po siya sa 1.8 plus 32. 1.8
Oh,
plus
yeah.
32. Oo.
Yeah.
Oo nga pala, 1.8.
Multiply nyo lang siya sa 1.8, and then, yung product niya, i-add nyo lang. Mag-add lang kayo ng 32, and yun na po yung value ng Fahrenheit. Ayun. Okay, so number 10, 108.6 Fahrenheit equals how many degrees Celsius?
I vote Jax.
Sige, kuya.
Ang bastos talaga dito. Ako talaga binabawian, no?
Jax! Dibay.
Diba?
Bagsak ka na, ha? Ikaw na yun.
Papa-recount ka ba? Para kang si Trump, pa.
Ay, lako.
Recount ka na, Jax.
Visit.
Ito ka.
Teka. Visit. Papaano na naman ako dito?
Ba yan?
Ako talaga binabote, nakakainis eh. Kung kailan di ako prepared, alam mo yun?
Kasi alam ko tumatahimik kayo, ibig sabihin hindi mo alam yung sagot.
Hindi, kung kanina, di ba, yung binigay na example is yung times 1.8 plus the 32, di ba? Di kung kung Celsius naman ang hinahanap at meron yung Fahrenheit, edi Fahrenheit minus 32 divided by the 1.8.
Ay,
Mali.
kala ko
Ah!
tatama.
Eat shit! Akala nyo
That's still wrong. It's wrong.
That's still wrong, bro.
It's wrong.
Kala ko tatama ka na eh.
Wisit! Talaga. Binubuli ako
A for
dito.
effort, bro.
Convincing ba? Convincing. Alam ko convincing naman ito. No?
Akala ko nung una tama na eh. Tapos nung last na statement mo ay... Okay. Sige, ikaw nga Kuya JP, ano answer mo? Formula.
Yung ginamit ko kasi yung isa eh. I-try natin yung kay Jax. 5/9 yung ginamit ko. So, pareho. So, degrees Fahrenheit, 108.6 minus 32. So, that's 76.6 times 1.8 times 1.8. Parang mali. What's mali? Pag yung 1.8 ginamit ko.
Baligtad
5/9
kasi.
kasi ginamit ko kanina.
Baligtad yung...
Ata.
Pwede rin yung division na ginawa mo, Kuya JP. That's still correct. Pero kapag Fahrenheit to Celsius, ang gagamitin mo ay 5 divided by 9.
Oh, so we won't use the
Oo.
1.8 na.
No.
Hindi na. So kapag...
Misleading
kapag
pala to si
naman,
Jax eh. si Jax may kasalanan.
Yun
So we
naman,
use yung
kapag
fraction
naman-
doon sa... Okay.
Hindi, same lang din. Kasi 9 divided by 5, that gives us 1.8 pa din eh. 'Di ba? So, always remember po, kapag... Ay, nahulog ko po. Always remember po, kapag ang hinahanap ay from Celsius to Fahrenheit, ang ating formula po is, di ba Celsius to Fahrenheit yan? Yung Celsius times 1.8. Yung 1.8 kasi equivalent din naman siya sa 9/5.
9/5.
So, oo. So, correct pa rin po kayo. Yan. So, Celsius times 1.8, equivalent ng 1.8 is, di ba, yung 9/5. 1.8 pa rin ang lalabas. Plus
Yeah.
32. Yun po ang kapag Celsius to Fahrenheit.
Celsius to Fahrenheit. Mm-mm.
Yes. Kapag naman Fahrenheit to Celsius, ang ating formula po ay Fahrenheit minus 32, okay, times 5/9. So, 5/9 ay 0. Ilan?
0.6. 0.55.
Okay. 0.55. 0.55. So, we're going to use 0.55 and that's standard na po. Ayun.
Okay.
So, let's try. Fahrenheit 106.6 minus 32 times 0.55. So, ilan po yung natin, yung anong total? Ano answer
42
natin?
42.13.
42.1. Oh, tama ka rin. 42.1 or 42.14. 76.6.
8.6.
Ayan. 42.13 or 42.1 degrees Fahrenheit. I mean, Celsius. Okay po?
Yes.
Okay. Number 11. In which step of the nursing process does the nurse analyze data and identify client problems? Ano po yung ating clue dito?
Analyze data and
Identify.
Identify problems.
Yes. So, based from that, assessment ba yun?
No.
No.
Diagnosis.
Right? Okay, so the answer is diagnosis. Okay, so, yung question dito. So, ano ka lang, in the assessment phase, ang ginagawa natin is just to gather data from sources, di ba, from the client or based from our objective data. So, in the diagnosis phase, we are now identifying the client's health status. And sa planning, kung maalala po niyo yung discussion natin last time, so in our planning, dito po lumalabas yung ating goals and objectives and yung ating outcomes, di ba? And for the evaluation phase, this occurs after implementation of the different interventions, and we are now gathering the client's responses to the intervention that was administered to the client. Whether, di ba, meron po tayong criteria for the evaluation if, di ba, fully met, not met, and partially met. Kung maalala pa po ninyo. Ayun. Okay. Number 12, in which phase of the nursing process, thus the nurse decide whether her actions have successfully treated the client's health problem.
D.
Okay? Ano po?
Letter D.
The
Delta.
answer is, okay? Yes, the answer is letter D. Ano ang ating clue po dyan?
Successfully treated.
Yes, very good. Okay, so yun lang po. Pag nakita nyo lang po yung mga terms na yan, clue na niya, alam ko na to, evaluation na to. Okay? Number 13, what is the most basic reason that self-knowledge is important for nurses? Bakit important ba ang self-knowledge? Because it helps the nurse to, ito, iba-iba yung answer nyo dito eh.
Letter A.
A. Identify personal biases. Char,
Okay.
wait lang. Ano ba sagot ko dyan? Ay, oo,
Yeah,
yeah.
letter A.
O, tama. Yun na nga yun.
Okay. May nag-answer ng letter B dito eh. Okay? So basically bakit po letter A ang ating answer dito?
Jax.
Ako na lang.
O Kuya Jax,
Hindi.
bakit?
Letter A is the correct answer because when you say self-knowledge, you are identifying yung self-awareness mo, kumbaga, your your personal perceptions about certain, ideas, concepts, etc.
And indirectly, the thinking is involved in identifying effective interventions, communicating, and learning procedures. Pero po, yun nga, yung pag-identify natin ng mga personal biases, actually, it affects our, di ba, yung mga nursing actions. So, basically, that is the reason for having for the importance of self-knowledge. Ayun. So, hindi po tayo nagbe-base merely sa ating mga di ba? Sa personal judgment natin. We are really basing on what is being said by science. Ayun. Number 14, arrange the steps of the nursing process in which they generally occur. Okay? Very easy, di ba? Ano ang mnemonics po natin dito sa nursing process? Our mnemonics is ADPI. Yes, ADPI. Number 15, how are critical thinking skills and critical thinking attitude similar? Both are?
Letter A.
Both are? Yes. Okay, correct po. Both influences the nurse's problem solving and decision making. Okay, so in here po, cognitive skills are used in complex thinking processes such as yung problem solving and decision making. And ano po ba ang pinapertain mismo ng ating critical thinking? It determines now how a person uses his or her cognitive skills. And ito rin, kasama rin po dito yung mga traits of mind natin such as yung independent thinking, intellectual curiosity, intellectual humility, and fair-mindedness. Okay? Ano naman po yung kasama sa ating critical thinking skills? Kapag yung critical thinking attitudes natin, it determines how a person uses cognitive skills. Kapag naman po sinabi natin critical thinking skills, this refers to the cognitive activities used in complex thinking. Ano yung mga examples po nito? Recognizing, ano, mga gap in one's own knowledge or separating relevant from irrelevant data. Yun po yung kasama sa critical thinking skills. Yung attitudes, kung paano po natin ginagamit yung ating mga cognitive skills. Yun yung critical thinking attitude. Okay, number 16. The nurse is preparing to admit a patient from the emergency department. The transferring nurse reports that a patient with chronic lung disease has a 30-plus-year-old history of tobacco use. So the nurse smoked 8 cigarettes a day at one time and worked very hard to quit smoking. She immediately thinks to herself, I know I tend to feel negatively about people who use tobacco, especially when they have a serious lung condition. I figure if I can stop smoking, they should be able to. I must remember how physically and psychologically difficult that is and be very careful not to be judgmental of this patient. So this best illustrates what?
Letter
B.
B.
Self-knowledge.
Okay, so the answer is, yung nasabi rin po natin kanina, this best illustrates
Letter B. Self-knowledge.
self-knowledge. Ano po yung ating cue dito?
Immediately thinks to herself.
Yes. Okay, very good po. She immediately thinks to herself. Sabi nga natin kanina, self-knowledge, okay, is an awareness of one's beliefs, values, biases, and so on. Okay? So, yon. So, in here, this now describes that the nurse awareness, okay, that her bias can affect her patient care. Okay? Kaya nga po, if you're providing patient care to our patients, we should not really based on our personal belief, di ba? So, gaya ng sinabi ko kanina, we should really base it on standards and dapat evidence-based po tayo. Okay? And, yun, wala naman pong question, ano? So, which organization, may hindi nakakuha dito. Which
Ito,
organization
hindi ko gets to.
standards require that all patients be assessed specifically for pain? So, anong organization daw po ang require that all patients be assessed specifically for pain?
The
May
Joint
may
Commission.
nag-answer ng ANA dito eh. Porque ano, okay. So, the correct answer is letter D. Okay? The Joint Commission has actually developed assessment standards including that all clients be assessed for pain. Ano po ang ANA? Ang dinevelop nilang standards ay for clinical practice, including those for assessment, but not specifically for pain. Okay? And State Nurse Practice Acts. Okay? Ito naman po yung organization or body which regulates nursing practice in individual states. Okay? So, per state in the US, New York, Illinois, California, or Arizona, kahit anong state po doon, they have a State Nurse Practice Act. And the NCSBN, so this asserts that the scope of nursing includes a comprehensive assessment but does not specifically include pain. Okay? So, yung NCSBN po, comprehensive assessment. So, it encompasses everything. Comprehensive pa. But, for pain, Joint Commission lang po. Okay? Joint
So is
Commission.
the joint... Sorry, I
Mm.
have a question. Is the
Sige
Joint
po.
Commission specific sa nursing profession? Sa mga nurses? Or na organization? Or...
Opo. Organization din siya, okay? Pero ang pinaka-main na target niya is assessment standards for pain. For pain lang po.
Okay.
Yung ANA kasi, meron din siyang mga standards for clinical practice. Lahat ng assessment, but not specifically for pain. Kaya, yung nag-answer nun, tama na nag-assess siya ng pain, pero hindi lang yun yung nakasama sa standard niya. Dahil commission lang yung organization na kung saan ang nilabas nila ng mga standards of practice is for pain lang. Ayun.
Oh, okay.
Ako.
Ah,
I've
specifically
never
for
heard of the
pain.
Joint Commission kasi.
Same.
Okay.
Ah.
Mm-mm.
Actually, ako din. First answer
Kaya
ko dyan is
sinagutan ko lang yung ANA yata.
NCSBN. Kasi yun lang yung familiar sa akin.
Oo. Yun nga din. Actually, yun nga po yun yung maganda na ngayon nire-review natin yung mga different questions na to kasi by the time na subscribe na tayo later on sa UWorld, mas helpful talaga siya kasi kumbaga na-familiarize na tayo sa mga different terminologies na nakita natin in the past. And I think, di ba, next year din naman po kayo mag-take ng NCLEX. And good decision po talaga na ngayon pa lang nag-i-start na kayo. And at least walang pressure, di ba? Walang pressure unlike kunwari next month na yung exam mo. So parang ang tendency ng mind natin yung mind natin is ma-overwhelm siya sa lahat sa madaming information na nakukuha natin kaya parang mahirap mag-grasp ng mind. Unlike ngayon na at least hindi tayo masyadong nagre-rush or unless nagre-rush kayo.
Si Jessica nagra-rush for some reason.
Hindi ako nag-rush. It's just that nasa-stress ako. There are a lot of things that I don't know.
Pero dito po sa atin until March walang schedule for examination ng NCLEX. Unless pupunta ka na agad ng US. Kunwari, na-petition ka for fiancé visa. Charot. Tapos, doon ka na mag-take kasi doon may schedule sila for exam eh. Pero yun, hahanapin pa rin kasi yung eligibility before ka schedule sa diba, sa makapag-schedule sa person view. Ayun. Okay, number 18. Which of the following is an example of data that should be validated? Okay? So, ano po yung answer natin dito? Yung dapat natin i-validate?
This I got incorrectly. Pero, ano nga ba yung answer dito?
Hindi ba
Letter B. Letter B yung answer and then I realized na bakit.
Oo. So, bakit? Since validation should be done when subjective and objective data do not make sense. So, kung makikita po ninyo sa letter B, the client states that he feels feverish and you measure the oral temperature at 98 degrees Fahrenheit. Okay? Tayo kasing mga Filipino, hindi tayo sanay sa Fahrenheit, diba? Parang sanay talaga tayo sa sa Celsius, diba? So if you're going to convert this, sige nga, Kuya Jax, kindly convert 98 degrees Fahrenheit to Celsius. Very fresh lang to kaka-discuss lang kanina.
Teka. Ito, go-compute na. Grabe kayo.
Sige.
Pero may dispute ako sa formula.
Or hindi dispute yun, search mo pa sa Google.
Na-search ko na po. Iba yung formula ko sa formula na sinasabi nyo. And may variance yung sagot, pero same 42.
Hindi, mali yung formula mo. Kasi you said 9/5. It's 5/9.
Sinabi ako 5/9?
No, you said 9/5.
Okay, whatever. Whatever.
Magpapiyat ka na, Kitty. Hay, nako.
Oo. 9/5 yung sinabi mo, Kuya Jax. Kaya sabi mo, di ba, 1.8?
Mm-hmm.
Okay.
Teka.
Sige.
36.3.
Okay, very good. 36.3. And is that an objective or subjective data?
Objective data.
Okay, so anong subjective data natin?
Yung feeling feverish.
Yun. Okay, so ito yung example ng data na kailangan nating i-validate. Kasi sinasabi niya, parang nilalagdat ako, di ba? So, chinek mo naman yung temperature niya, 36.3 degrees Celsius or 98 degrees Fahrenheit. And that's normal, right? So, yun po. yun yung kailangan na data na kailangan nating i-validate. And take note po na validation is not usually necessary for laboratory test results. Okay? So, hindi na po natin scope yun na, ay, bakit yung urinalysis ganito, ganyan. So, we do not usually validate those kinds of results or tests. Unlike sa ating assessment dito, na the client states she feels feverish and when you've checked the temperature of the patient, normal naman. So, ito yung example na kailangan ng validation. And yung other answers naman po dito, wala naman pong inconsistency. So, the client has clear breath sounds. You count a respiratory rate of 18. So, wala naman pong discrepancy dyan when it comes to kasi ang chinek mo lang naman dito is more on objective data ka dito, di ba? So, nag-aspirate ka and clear breath sounds and nag-count ka ng rest ng RR niya, which is 18, normal naman. And letter D, the chest X-ray report indicates that the client has pneumonia in the right lower lobe. Okay? So, sabi ko kanina, yung ating mga laboratory tests, hindi po natin, we do not usually validate those information. Ayun. So, after our rationale po ng mga ng dito, si Ma'am Jess nakapag-retake na siya eh. So, yung hindi pa nakapag-retake, you may. Number 19, para may comparison po kung na-discuss ba yung question or hindi para makita natin yung scores niyo. 19, which of the
matataasan
following...
na nila ako ng 4. Movie ko na naman ako eh.
Yes, wala lang bawi, touch move na yun.
Which of the following is an example of appropriate behavior when conducting a client interview? Ito, di ba? Yung tamang gestures, kasama po yun dito. So, what is your answer here?
Letter D.
Okay, very good. Letter D. Very obvious naman, no? Diba? Kung maalala niyo yung mga discussions before, active listening should be used during an interview and yung gestures natin would really implicate something. So, syempre, sitting and facing the client in a chair at the client's bedside, and that indicates that we are parang eager tayo na makinig sa kanya, sa kung ano man yung i-share niya sa atin. And the nurse should face the patient and we should have a relaxed posture and we should keep eye contact. Diba? Parang same lang din kapag nakikipag-usapan sa ibang tao. Kapag nakikita nyo na hindi sila interested, diba? Pansin sa gestures nila. Like, for example, tingin ng tingin sa watch niya or kaya nagkikwento siya pero ibang tinitingnan. So, that's a sign na hindi ka interested sa sinishare ng kasama mo. Yun. So, asking why may make the client defensive. So, asking the client, why did you think it was necessary to seek healthcare at this time? So, ang makikil kasi ng pasyente dyan is parang parang minamandate mo siya na magbigay talaga ng answer. Okay? So, note-taking interferes with eye contact and the client may not understand medical terminologies. Okay? Or healthcare jargon. So, whenever we are dealing with patients or communicating with our patients, we should use layman's term. Yan. Okay? And of course, another part din po ng communication technique natin is we should always use an open-ended question. Diba? May mga different types tayo ng communication. We have the close-ended, open-ended, and yung open-ended natin, yun yung exploratory. Okay? For example, mga close-ended natin yun yung one question, one answer. Like, for example, anong pangalan? What's your name? So, Jocks. What's your name, Jessica? Or how old are you? So, that's a close-ended question. Yung wala ng follow-up. So, every time that we're communicating with our patient, it should always be an open-ended. Okay? So, yun po. Number 20, the nurse wishes to identify nursing diagnosis for a patient. She can best do this by using a data collection from organizing according to, so in here, so that all that apply.
Dito nagkamali na naman ako. My answer was A and B. Because I remember
Mm-mm.
the assessment form that we have in the hospital upon admission. Pero mali yung
Mm-mm.
sagot ko. CND pala yung sagot. Wala akong tinama.
Hmm. Oh, tapos yun nga po yung mga sila Kuya Jack din po, ang in-answer nila is isa lang din. And fault ko yun kasi yung ginawa ko sa Google Form, isang answer lang. Pero ano po yung ating clue dito? Clue muna, in test taking strategy. One clue is to check for the kung ano yung hinahanap, diba? So, ang hinahanap dito is select all that apply. So, meaning, more than one ang ating answer dito.
Uh-huh.
Okay? So, kapag nandyan na po, very important tong mga terminologies na to. Select all that apply or mga word na except, which is the most priority nursing diagnose, mga ganun. So, very important po yung mga keywords na yon. So, in this case, SATA, diba? And marami pong select all that apply sa NCLEX examination. So, in here, ang ating answer ay letter C and D. Bakit? Bakit Maslow's and Gordon's? Since, okay, nursing models produce a holistic database that is useful in identifying nursing rather than medical diagnosis. So, body systems and head-to-toe are actually not nursing models. Okay? And they are not holistic. They actually focus on identifying physiological needs or disease. Okay? However, dito naman sa ating Maslow's, hindi rin actually siya nursing model. But this is considered as a holistic. So, this is acceptable for identifying nursing diagnosis. Okay? And yung Gordon's naman natin, this focuses on the functional health patterns, which is a nursing model. So, ginagamit din po natin siya to identify, okay, yung nursing diagnosis. Okay? Yun po. Always remember na ang approach po natin whenever we identify nursing diagnosis, gumagamit po tayo ng either a nursing model or a system, okay, that is holistic. Okay, yung ating body systems model, as I've mentioned earlier, and yung head-to-toe framework, hindi po siya nursing models and they are not holistic. Okay, hindi holistic yung approach as compared with the Maslow's. Hindi nga siya nursing model, pero holistic ang approach niya, di ba? From hindi ka makaka-achieve or hindi mo ma-reach yung self-actualization kapag hindi mo na-meet yung mga lower needs na nasa physiologic needs. Mga ganun siya. Okay? Number 21. So, number 20, ang answer natin ay dalawa. We have the Maslow's hierarchy of needs and Gordon's functional health patterns. Okay? Number 21. The nurse is recording assessment data. She writes, the patient seems worried about his surgery. Other than that, he had a good night. Which errors did the nurse make? Okay, test-taking strategy, select all that apply. SATA na naman siya. Okay? So, meaning dalawa or more than one ang answer natin. So, in here, the correct answer is or are
A, C, and D.
okay,
Sabi.
very good. A, C, and D. Sabi dun sa ano. Okay, so the nurse recorded a vague generality. He has a good night. Okay, so the nurse did not use the patient's exact words, but she did not quote the patient at all. So that is not one of her errors. Okay, the nurse used waffle word. Okay, and seems worried instead of documenting what the patient said or did to lead her to that conclusion. And lastly, the nurse recorded his inferences, worried, and had a good night. Okay? So, yun.
Ay, oo nga. Alam ko naman, Nico. Ayoko na nga. Ah? Hindi. Oo nga. Lahat naman yan mali. So, in my head, I chose everything. Kasi sabi ko, mali yan sa lahat ng documentation. Eh, hindi pala. Which errors did the nurse? Ay, nako. Careless.
Oo, di ba? Which error did the nurse make? So, very important po talaga. Usually, ito pa po pala, another test-taking strategy, usually, may contrasting data yan eh. Marami siyang mga information na sinasabi sa una. Tapos, yung pinaka hinahanap lang pala niya is yung nasa dulo. So, yun. Yun lang po, usually. Mas marami pang mga question na ang haba-haba ng statement nila. 'Di ba? Yung introductory statement. Tapos yun pala, parang which is the priority, so yung which is the priority nursing assessment in this, mga ganon. So, yung pinaka dapat nyo pong i-check lagi dyan is yung nasa end na question. Kasi usually, dun nalilito yung mga nag-answer. Kasi like, for example, di ba, which errors did the nurse make? Yan. Okay? Number 22, a patient is admitted with shortness of breath, so the nurse immediately listens to his breath sounds. Which type of assessment is the nurse performing? Anong keyword natin?
Assessment. Uh,
Letter C.
yeah. Letter C.
Yes.
Keyword kasi yung tanong, Jax, kaya hindi pa ako sumagot eh. Nulong. I would say, yung keyword dyan would be, knowing that the patient, yun nga, may shortness of breath, tas dumiretso siya sa listening of breath sounds.
So, ang keyword natin is yung immediately. Yun. So, immediately meaning, nag-focus lang tayo sa isang aspect ng physical assessment. That's why, alam na agad natin, di ba, yung focus is, yun na, kung saang specific system or location na-obtain yung data. Okay? Paano po ba yung ongoing assessment? Ongoing assessment is performed as needed after the initial data are collected, preferably with each patient contact. Ano naman yung comprehensive? This includes an interview and complete examination per system. Okay? So, whole system yon, comprehensive nga eh. How about the psychosocial assessment? This examines both these psychological and social factors affecting the patient. Ayun. So, when we are conducting psychological assessment, kasama po dito yung mga information about stressors, lifestyle, emotional health, mga social influences, coping mechanisms, personal responses to health and illness, and marami pa pong iba. Okay? So, yun. Number 23, the nurse is assessing vital signs for a patient just admitted to the hospital. Ideally, and if there are no contraindications, how should the nurse position the patient for this portion of the admission assessment?
Letter A, sitting upright.
Okay, so the answer is letter A. Ayun. So, wala naman pong question dito sa ating positioning. So, nasabi naman po kasi dito na, okay, so there are no contraindications. Sitting upright is still the best answer. So, able naman yung patient. Number 24, for all body systems except the abdomen, di ba na-mention ko yan before, what is the preferred order for the nurse to perform? Okay, following the examination techniques. The answer is, number 24, answer is letter
C, B.
Okay, letter B. Okay,
Oo,
start po muna tayo sa
inspection.
inspection. Okay, inspection. After inspection, palpation, percussion, and auscultation. Except for the abdomen, ano nga po ang ating sequence for assessment sa abdomen?
Inspection, and then auscultation, percussion, and then palpation last.
Yes, ayapepa. Okay, bakit nga po ulit ayapepa? Kasi
it might alter the bowel sounds.
yes,
Or
perfect.
putukin mo yung aneurysm niya, ganun.
Opo. Ayan. So, all systems we're utilizing the yung regular sequence except for the abdomen wherein we're utilizing ayapepa. 25. The nurse is assessing a patient admitted to the hospital with rectal bleeding. The patient had a hip replacement 2 weeks ago. Which position should the nurse avoid when examining this patient's rectal area? Number 25. May mga hindi po nakakuha dito.
I was clueless. But I think, if I remember correctly, the correct answer there is semi-foulers. Yata. Avoid. Avoid ba? Oo yata eh.
Shit, yun yung mali ko. Di ko nakikita yung avoid.
Oo, semi-foulers ata yung tamang sagot.
Mm, semi-foulers. Take note po
Siyempre,
na
hula, no?
merong hip replacement yung yung patient. Ito yung
Sims.
ito yung
Sims position.
nakakalitong data. 'Di ba? Ito yung nakakalitong data. Kasi normally, kapag sinabi nating Sims position, this is usually the best position to examine the rectal area.
For
Okay?
rectal exam.
However, the position should be avoided if the patient has undergone
And
hip
hip
replacement surgery.
replacement.
Yes. And since yung patient nag-undergo siya ng hip replacement, ano dapat yung mga position na best sa kanya? Okay? Pwede ang supine,
Supine.
pwede ang supine, pwede ang dorsal recumbent or
Dorsal.
semi-Fowler's position without
Okay.
causing harm to the joint. Okay? So, yun po. Supine, di ba? Just lying on the back, facing upward. Yung dorsal recumbent, paano po ito? Sige nga, pwede pong gawin niyo yung dorsal recumbent.
Jax!
On camera.
JP pa kay.
Okay? And semi-Fowler's position. Yan. Okay, so, ang hinahanap dito, should the
Sims
nurse
pala.
avoid? Yes, the answer is team. Ayun. 26. How should the nurse modify the examination for a 7-year-old child? Okay? Yung mga 7-year-old, mga grade, diba? Grade 1 or 2. School age na siya, right?
Mm-mm.
Okay, we're going to consider that as school age na po. And the best answer here is
C.
The correct answer, I think, is no. That's my answer eh. Mali din ako. The correct answer there is letter B.
yes, okay? So, you're going to demonstrate the equipment before using it, okay? Bakit nga po yun? Kasi usually, yung mga school age child, very explorative na yan. So, parang ayaw nila na may gagawin kasi sa kanila hanggat hindi mo muna pinoportray or hindi mo muna dinademonstrate kung paano gamitin yon. Okay? Ask the parents to leave the room before the examination. Hindi po siya yung best na answer. Bakit?
Matatakot
Ano
lang
po sa
siya
tingin
daw.
mo? Okay. So, allow the child to help with the examination. Hindi rin po. Yun yung, hindi rin yun yung pinaka-best. Kasi, ito po ginagawa natin if our patient is a preschooler. Okay? Kumbaga parang kinukuha mo yung, yung support niya, di ba? Para at least magawa mo yung examination sa kanya. Sige, ikaw nga gagawin mo ito sa akin, mga ganon. So, hindi po ito yung pinaka-best approach sa school age child. Pwede natin gawin to kapag yung pasyente natin ay preschooler. Okay? And dito, perform invasive procedures last. So, it is best to perform invasive procedures last for all age groups. Therefore, hindi naman na po ito yung answer natin. Kasi specifically, for 7-year-old child lang naman. Okay? So, letter D is for all ages. Okay, ito. For all ages po siya. For all ages siya. Allow the child to help with the examination. This is for preschooler. Okay? And ask the parents to leave the room before the examination. This is done for adolescents. Kasi di ba yung mga adolescents usually nahihiya sila pag andyan yung parents nila. Di ba? Mga ibang itatanong dyan, ano ba yung mga usually tinatanong sa mga adolescents kung may mga crush mo, mga ganun, di ba? So, parang nahihiya sila pag andyan yung parents. So, hindi po siya best for a 7-year-old child. Okay? Number 27. The nurse must examine a patient who is weak and unable to sit unaided or to get out of the bed. How should she position the patient to begin and perform most of the physical examination? Okay? So, ano pong answer natin dito? Our answer is
Semi-Fowlers.
Okay, semi-Fowlers. And I think lahat naman po nakakuha dito. So, no question. Ito ha. The patient is weak and unable to sit unaided or to get out of bed. Okay? So, pinaka-best na position po dyan ay ang semi-Fowlers. Okay? Yan. Okay, number 28. The nurse should use the diaphragm of the stethoscope to auscultate which of the following. Diaphragm, diaphragm. Saan ang diaphragm natin? Diaphragm dun sa ating stethoscope. Yung
flat.
malaki po ba? Oo, yung malaki na circle na flat or yung ano. Okay, so yung flat yun po yung ating diaphragm. Okay, so our answer here is that number 28. Answer is
Vowel sounds.
letter
C. Vowel sounds.
Yes, letter C. So, para hindi pa tayo malito, the bell of the stethoscope is for low pitch. Okay? Ano yung clue natin dito? Bell, low. Okay? The bell of the stethoscope is for low pitch. Bell, low. Okay? So, yun lang po. And number 29, ano pa yung mga examples pala ng low pitch sound natin? Can you give an example ng mga low pitch?
If you're listening to the heart sounds ng fetus. Fetus!
Okay. Okay,
Yun lang
or
alam
yung
ko.
mga okay, ano pa po, yung mga murmurs, 'di ba? Kapag may mga cardiac problems or cardiac abnormalities yung pasyente natin, kung napapansin niyo yung mga doctors, ang ginagamit nila ay and even us, 'di ba? Dapat alam natin 'yon. Na ang gagamitin natin to assess for the presence of murmur if there is murmur. I mean is the bell. Okay? Another example ng mga low pitch, yung mga brewy or yung mga jugular hums. Ayan. Okay, number 29. The nurse calculates the body mass index of 18 for a young adult woman who comes to the physician's office for a college physical examination. So this patient is considered as what?
Underweight, letter D.
Okay, underweight. Okay, for adults, BMI should range between 20 and 25 and ito 18 is considered as underweight. Number 30, the most important nursing intervention to correct skin dryness is ito may mga lahat kayo nakakuha naman dito. So the answer is letter D. Encourage the patient to increase his fluid intake, use non-irritating soap when bathing, and apply lotion to the involved areas. Okay? So, letter A, avoid bathing the patient until the condition is remedied and notify the physician. Hindi naman yun. Yun yung, hindi man yun yung best dito. Ask the physician to refer the patient to a dermatologist. Bakit hindi yun? Kasi, hindi naman tayo agad-agad magsasabi sa physician. We should perform nursing intervention first and consult the dietitian about increasing the patient's fat intake, hindi naman agad-agad, di ba? So, pinaka-best nursing intervention and a very important nursing intervention here is to encourage the patient the more on educative nursing care. Okay? Number 31, when bathing a patient's extremities, the nurse should use long, firm strokes from the distal to the proximal area. When we say distal, ano nga po ulit ito?
Farthest away from the center.
Okay. Okay, so malayo papunta sa yung proximal, yung nearest area. Okay, so this technique is ano yung rationale for this? Bakit gumagamit tayo ng firm strokes and from distal to proximal? Because this increases venous blood return. Okay, kung maalala po ninyo yung RD natin ng bed bath, 'di ba? Laging sinasabi to start from distal to the proximal area to increase the venous blood return. Okay? In addition, it will actually stimulate yung proper circulation, thereby preventing venous stasis. Yan. And it improves circulation but does not result in vasoconstriction. And The nurse can assess the patient's condition throughout the bath, regardless of washing technique, and should feel no strain while bathing the patient. Okay? So, yun. May nag-answer po ata dito ng letter B, avoids undue strain on the nurse. Ayan. So, ang pinaka target natin dito is yung patient. Yun. So, kaya dapat um,
Ay, sorry.
okay, number 32. Nursing interventions that can help the patient to relax and sleep restfully include all of the following except. So, ito na naman po yung ating key point. Okay? Or yung keyword natin dyan, except. Diba? So, the answer is
I got this all incorrectly. Sa ilang beses na nag-pop up yan, mali ako. But the
number
correct
32.
answer is letter A.
Oo. Okay, bakit letter A po? Because napping or naps in the afternoon is not conducive to nighttime sleeping. Okay, ano yung mga dapat na na nursing interventions natin? We should provide or educate them to, diba, to read, mga read book or massage, okay? And yun talaga yung makakapag-stimulate ng sleeping sa pasyente. Number 33, nursing interventions that can help the patient to relax and sleep restfully. Ay, naulit lang yan. Number 34, Kubler-Ross, 5 successive stages of death and dying are DABDA. Okay, so the answer is letter, ano po?
Letter C.
Letter C. Okay.
Letter C.
Number 35, a terminally ill patient usually experiences all of the following feelings during the anger stage except answer is
Letter
letter
C.
C, numbness. Okay? Kasi ang numbness po, that is typical for depression stage. And yung the anger stage includes the feelings of rage, envy, resentment, and the patient's questioning, why me? Okay? So, yun po. Okay pa po kayo sa time? Or baka ituloy pa po natin?
Okay pa naman ako.
Okay naman ako.
Yep, yep.
Sige po. Okay, so let's proceed. Dun sa set 2 naman. Ayan. So, number 36, when bathing patient's extremities. Ayan, naulit lang din yan. Number 37, vivid dreaming occurs in which stage of sleep? Okay, so answer here is number 37,
Letter
REM.
letter B. Diba? Letter B. Yung ating rapid eye movement or yung REM. Okay? How about the others? Yung stage 1.
Actually, nalaan ko lang to.
Kasi yun yung
Kasi
parang
yun
common.
lang yung familiar
Oo,
sa
yun
akin.
yung familiar. Okay? Yun nga actually, yun din yung commonly na sagot dito na bakit yun yung answer mo? Kasi yun yung familiar ako mga ganyan. Okay, so yung ating delta stage po. Delta stage or slow wave sleep occurs during non-REM stages 3 and 4 and is often equated with quiet sleep. Yun yung ating delta stage. Ano ba yung non-REM natin? This is a deep, restful sleep without dreaming. So ito po yung ating stage 2 or non-REM. How about for stage 1? Yun yung ano po sa tingin nyo?
Stage
Stage 1 non-REM. Yun nga po yung yung restful sleep siya without dreaming. Stage 1 non-REM and stage 2 non-REM. So, isa lang po siya, different stages lang. Pero dito, restful sleep. Ito yung tulog na tulog ka talaga pero walang nangyayaring dreaming. So, nangyayari lang po talaga yung vivid dreaming sa ating REM stage. Okay? Next, number 38. The natural sedative in meat and milk products, especially warm milk, that can help induce sleep is Siguro kung ano lang naman yung
Tryptophan.
familiar kayo. Yun ba yung familiar kayo? Okay, so the answer
Tryptophan was,
here is,
ano to? Favorite na ko ni Sir Marzan yan eh.
oo,
Ayaw
yeah,
naaalala.
tryptophan.
Basta milk
Oo,
tryptophan.
tryptophan. Nalala ko din yun eh. So, yung mga pam na yan, mga zepam, di ba? So, those are examples of hypnotic sedatives. Yan. Okay? Number 39. Actually po, sa akin lang kasi ina-answeran ko din ito bago ko din i-send sa inyo. Naalala ko pa talaga yung mga review nung NLE natin, kaya very helpful pa din po talaga siya ngayong NCLEX. So parang binabalikan lang natin yung mga concepts na naaral na rin talaga natin in the past. Parang nag-refresh lang talaga. Number 39, there's interventions that can help the patient to relax and sleep restfully include all of the following except, naulit na naman to. Number 40, nurses and other healthcare providers often have difficulty helping a terminally ill patient through the necessary stages leading to acceptance of death. So which of the following strategies is most helpful to the nurse in achieving this goal? Number
Letter
40,
B.
our answer is letter
C.
C.
Letter C. Letter C.
Perspective.
Oo, letter C. So, according to the thanatologist, reflecting on the significance of death helps to reduce the fear of death and enables the healthcare provider to better understand yung terminal ill, okay? Terminally ill patient's feelings. And it also helps to overcome the belief that medical and nursing measures have failed when a patient cannot be cured. Ayan. Number 41, which of the following symptoms is the best indicator of imminent death? Imminent
Letter
death. Ano
C.
tayo po? Okay, the answer is letter C. Yan. So, fixed dilated pupils are sign of imminent death. Yung iba po na nakita nyo, yung pulse becomes weak but rapid. Muscles become weak and atonic and periods of apnea occur during respiration. 42, nurse caring for a patient with an infectious disease who requires isolation should refer to guidelines published by, kung maalala nyo, lagi ko itong mini-mention nung nag-discuss po ako last time. The answer is letter B, Centers for Disease Control or yung CDC. Okay? So usually sila po yung nagpa-publish ng mga updates and guidelines on caring for patients who require isolation. Yung NLN po natin or yung National League for Nursing, yung major function po nila is yung is to accredit nursing education programs in the US. Okay? So yun po yung NLN natin. Yung AMA natin, American Medical Association, organization body siya for physicians, so hindi natin scope din yun. American Nurses Association naman, national organization for nurses. So, basically, yan, letter B. 43, to institute appropriate isolation precautions, the nurse must first know, ano po ang answer natin? 43, must first know the letter A. Okay? Organism's mode of transmission. Okay? Wala naman pong problem dito, no? Number 44, which is the correct procedure for collecting a sputum specimen for culture and sensitivity testing for CNS. Number 44, the answer is letter B. Diba? Another thing, okay. I mean, 44 pala. 44. The answer is letter C. Diba? Have the patient expectorate the sputum into a sterile container. Okay? So, bakit po yun? Because this will now ensure that it will not be contaminated. Kaya kailangan laging sterile yan. Okay? The other answers are incorrect kasi they do not mention about sterility and because antiseptic mouthwash could destroy the organism to be cultured. Kaya, take note po, hindi tayo nagpapa-antiseptic mouthwash before we collect specimen for CNS. Next,
Oh,
number
okay.
45. An autoclave is used to sterilize hospital supplies because letter D, di ba? Yung ating autoclave, that is an apparatus. Oh, sorry po medyo parang ang ingay. Hindi ko alam kung sa akin ba yun.
Baka si Jax.
Excuse me, nakamute ako.
Okay.
Kahit hindi.
Nakamute nga yung
Pero
headset
pero
ko.
okay lang naman. Naiintindihan niyo naman po yung ano, no? So, autoclave, that is an apparatus that sterilizes equipment by means of high temperature pressurized steam. And this is used, okay, because it can destroy all forms of microorganisms, including spores. Okay? So, yun po. Number 45. 40, naulit yung 45. The best way to decrease the risk of transferring pathogens to a patient when removing contaminated gloves is to answer po, letter
Letter
E.
C.
Yes. Okay. So, turning the gloves inside out while removing them keeps all contaminants inside the gloves. Okay. So, they should then be placed in a plastic bag with soil dressings and discarded in a soiled utility room. Okay? So, usually dapat meron tayong utility room and dapat naka-double bag siya. So, kapag na-discard na siya sa isa, dapat i-double pa siya para prevent po yung pag-spread ng pathogens or microorganisms sa ibang patient. Okay? Yun. 46. After having an IV line in place for 72 hours, a patient complains of tenderness, burning, and swelling. Assessment of the IV site reveals that it is warm and erythematous. This usually indicates, okay, this usually indicates phlebitis. Okay? So, yung pagkakaroon ng tenderness, burning, and swelling are signs of phlebitis na po siya. Okay? So, infection is less likely because there is no drainage or wala namang fever. Infiltration would result in ano yung mga signs nun, may swelling, may pallor, okay? Or walang erythema. And the patient has no evidence of bleeding naman. Okay? 47, to ensure homogenization when diluting powdered medication in a vial, the nurse should. Okay, anong gagawin po natin dito? The nurse should, of course, roll the vial gently between the palms. Okay? Diba? Ni-roll natin siya. Hindi natin siya sinishake. Okay? Hindi natin din siya ini-invert ng and that is done for 1 minute. We are just rolling it gently between our palms. Okay? Number 48. The nurse is teaching the patient to prepare a syringe with 40 units of NPH insulin for self-injection. Okay? The patient's first priority concerning self-injection in this situation is to letter.
Ito mali ako dito, pero the correct answer is letter C.
Yes. Okay. Check the syringe to verify that the nurse has removed the prescribed insulin dose. Okay.
Oh.
So when we are teaching the patient to prepare an insulin injection, the patient's first priority is to validate, okay, the dose accuracy, and yung mga next steps po natin dito is to select the site, assess the site, clean the site with alcohol before injecting the insulin. Okay, so ito po yung pinaka-priority to verify that the nurse has removed the prescribed insulin dose. 49. The physician's order reads, administer 1 gram cefazolin sodium or Ancef in 150 ml of normal saline solution in 60 minutes. What is the flow rate if the drop factor is 10 drops is equal to 1 ml? Okay, 49. Answer po natin ay 25. Okay. Number 50, a patient must receive 50 units of humulin, regular insulin. The label reads 100 units is equivalent to 1 ml. How many milliliters should the nurse administer? Okay, our answer here is letter
A.
A, 0.5. Okay, 51. How should the nurse prepare an injection for a patient who takes both regular and NPH insulin? The answer is, ano po ang ating answer dito? Letter B. Okay, draw up the regular insulin, then the NPH insulin in the same
Mhm.
syringe. Okay?
Clear before cloudy yata yun.
Yes, clear before cloud. Yes, clear muna, which is yung regular, di ba? Pag regular insulin, laging, ano yan, usually, I mean,
Clear.
lagi siyang clear yung kanyang consistency, and yung ating NPH, yun yung cloudy, di ba? Clear, cloudy. 52, a patient has just received 30 milligrams of codeine by mouth or pain. 5 minutes later, he vomits. What should the nurse do first? Okay? Anong unang gagawin ng pasyente? Call the physician ba agad? Assess muna. So, observe for the emesis. Diba? Nag-vomit siya eh. So, i-observe nyo ano ba yung characteristics niya. Naisuka ba na pati yung gamot na naibigay sa kanya. Okay? So, expect nyo muna kung yung vomitus ba niya or emesis niya ay nagka-contain ng gamot, okay? Or yung check nyo yung color, check nyo yung consistency and yung amount. So, in this situation, the patient recently ingested the medication, so the nurse needs to check for remnants of the medication to help determine whether the patient retained enough of the medication to be effective. So, kung nakita nyo naman na enough na, well, kahit hindi na kayo mag-re-administer ng medication. 53, a patient is characterized with number 16 indwelling urinary folic catheter to determine if letter B, di ba? Kung yung kanyang 24-hour urine output is adequate. Okay? And take note that a 24-hour urine output of less than 500 ml in an adult is considered inadequate and may indicate kidney failure. So this must be corrected while the patient is in the acute state so that appropriate fluids, electrolytes, and medications can be administered and treated. Okay?
Sorry, ilang ml ulit? Sorry, ilang ml per hour?
Okay. 500
Is it 30 ml, di ba? 30 per hour?
500 ml, less than 500 ml in an adult. Yun yung 24-hour for 24 hours. So, if the output is 500 ml in an adult for a 24-hour urine, so that is considered inadequate already and may indicate kidney failure. Okay? Number 54, a staff nurse who is promoted to assistant nurse manager may feel uncomfortable initially when supervising her former peers. She can best decrease this discomfort by mga nurse by letter B.
Letter B.
Okay, making changes after evaluating the situation and having discussions with the staff. Okay, so as a new assistant nurse manager, okay, yung kapag bago ka, di ba, you should not make changes until she has had chance to evaluate staff members, patients, and physicians. Hindi ka agad-agad magbabago ng mga rules hanggat hindi mo pa na-discuss or nagkakaroon ng evaluation and discussion with the members of the team. And changes must be planned thoroughly and should be based on a need to improve conditions, not just for the sake of change. So, hindi ka lang magbabago basta-basta. Ay, hindi, kasi ako yung boss. Hindi ka basta-basta mag-implement. Okay? So, etong written assignments or yung writing down all the assignments, okay? This will allow all staff members to know their own and other responsibilities and serve as a checklist for the manager, enabling her to gauge whether the unit is being run effectively and whether patients are receiving appropriate care. So, Itong letter C naman po, telling the staff nurses that she is making changes to benefit their performance should occur only after the nurse has made a thorough evaluation. And evaluations are usually done on a yearly basis or as needed. Hindi yung, hindi yung on a daily basis. Usually, this is done on a yearly basis or as needed lang po. Number 55, Nurse Clarice is teaching a patient about a newly prescribed drug. What could cause a geriatric patient to have difficulty retaining knowledge about prescribed medications? Okay, our answer here is letter B. Okay, so yung sensory deficit nila, this could actually cause mga elderly to have difficulty retaining knowledge and prescribed medications. Yung decreased plasma drug levels do not actually alter yung patient's knowledge. Yung lack of family support may affect yung patient's compliance pero hindi yung knowledge retention. And yung Tourette syndrome, hindi na siya related sa ating knowledge retention. Ano ba yung Tourette syndrome? Naalala niyo pa po ba yun? Sa psych? Naalala niyo pa po yun?
Tourette syndrome.
Correct.
Diba? Yung Tourette syndrome natin, yun yung nagkakaroon ng mga repetitive movements or unwanted sounds or tics that can't be easily controlled. So, yun po. Number 56, when examining a patient with abdominal pain, the nurse in charge should examine what? The symptomatic quadrant last. Okay? Bakit nga po? Kasi, syempre, kung i-assess nyo yung yung symptomatic quadrant muna, there's a possibility na may mafe-feel siya agad na pain. So, tendency hindi mo na ma-assess yung ibang quadrants. Okay? So, always remember, kapag abdominal pain assessment yan, tapos nagkakaroon ng pain, lagi po nating i-examine yung symptomatic quadrant as the last. Okay? Yun yung last po natin i-assess. Okay? Number 57, the nurse is assessing a post-operative adult patient. Which of the following should the nurse document as subjective? Okay? Subjective.
Letter C.
C.
Patient's description of pain.
Vital signs, lab tests, ECG, those are objective data or information. 58, a male patient has a soft wrist safety device. Okay? Which assessment finding should the nurse consider as abnormal? Okay? As abnormal. Our answer here is letter C. Okay? So, a safety device on the wrist may impair circulation and restrict blood supply to the body tissues. Therefore, the nurse should assess the patient for signs of impaired circulation, di ba? Kapag may impaired circulation yung pasyente, ano yung mga manifestations niya? Cool, di ba? Cool yung kanyang cool kapag hahawakan siya or makikita po sa fingers ng pasyente na pale. So, ibig sabihin, there's an impaired circulation na. And in here, a palpable radial or ulnar pulse and pink nail beds are considered as normal. Okay? Normal findings yan. Kasi normally naman, pinkish naman ang nail beds. Palpable din naman ang ating radial and ulnar pulse. 59, which of the following planes divides the body longitudinally into anterior and posterior regions? Okay? May mga nalito po ata dito. So, our answer here is letter A. Okay? What is the other?
Mali ko yan eh. Sagittal yata nilagay.
Oo, sagittal.
Sagittal.
What's the other term for frontal? Other term for frontal is coronal. Okay? Frontal or coronal plane. Okay, so this runs longitudinally at a right angle to sagittal plane, dividing the body in anterior and posterior regions. Paano po yung ating sagittal plane? This runs longitudinally dividing the body into right and left regions. Okay?
Mhm.
Right and left regions po siya. And if exactly midline, this is called as the mid-sagittal. And, sorry.
demonstrate
And
by the
yung
GP
ating,
on cam.
and yung ating, yung transverse plane, this runs horizontally at a right angle to the vertical
Mhm.
axis. So, dividing the structure into superior and inferior. So, ang paghati po ng transverse ay up and down. Ganyan, di ba? Superior and inferior. Number 60, a female patient with a terminal illness is in denial. Indicators of denial includes what? In denial daw siya. Anong answer po natin?
Letter A.
Letter A, shock, dismay.
Okay, shock, dismay. These are early signs of denial, which is actually the first stage of grief. Ay, diba? Usually, talagang yun naman talaga yung manifestations ng denial na masya-shock ka talaga. And the other options are associated with depression, numbness, stoicism, and preparatory grief. Okay, number 61. The nurse in charge is transferring the patient from the bed to a chair. Which action does the nurse take during the patient transfer? So our answer here is letter B, diba? So after placing the patient in a high Fowler's position, anong gagawin natin? We are going to assist the patient dun sa bed na umupo, di ba? And to dangle his or her legs. Okay? And then the nurse faces the patient and places the chair next to and facing the head of the bed. Okay? So, ganun po. Ewan ko kung na-visualize nyo siya. And I'm sure you do. So, high Fowler's, okay, naka-high Fowler's position, and i-move natin sa side ng bed, and i-assist natin yung pasyente na maupo dun sa edge ng bed and i-dangle yung leg. Okay? So, yun. Case number 62, the nurse in charge is transferring, number 63, a female patient who speaks a little English has emergency gallbladder surgery. During this charge preparation, which nursing action would best help this patient understand wound care instruction? So our answer is, di ba, ang sabi sa question ay, konti lang yung kanyang, yung kanyang English. Okay. So what is the nursing action, okay, para ma-assess natin na naintindihan niya? The answer is letter
D.
D.
Demo, return demo.
Mag-return demo siya. So, patients may claim to understand discharge instruction when they do not. So, hindi tayo nag-rely doon sa kung ano man yung sinabi niya, or even sa family member, hindi din po tayo mag-rely doon. We should always rely sa ating patient. Dapat mag-return demo sila. 64. Before administering the evening dose of a prescribed medication, the nurse on the evening shift finds an unlabeled filled syringe in the patient's medication drawer. What should the nurse in charge do? Okay, so anong gagawin natin in that case? The best action is to discard. Okay, always remember, that's a safety precaution. Okay, if we are in doubt, diba, we should always discard. Parang sa OR din, ganun din ang ating concept. Yes, ganun din ang ating concept sa operating room. Na kapag hindi tayo sure sa kung ano man yung label, discard na natin. Okay?
Consider unsterile, yeah.
Yes. Kung ganun din sa ating life, kapag hindi ka sure, joke lang.
May hold.
65.
Jax, makinig ka ha. Sinasabi.
Excuse me.
Oo. Na, actually, habang sinasagutan ko to, parang iniisip, ano kayong magandang rationale dito para mas matandaan to? So, parang yun na. Yung naalala ko. Na kapag hindi tayo sure, dispatchahin na siya. Ganon.
Sa hospital namin kasi call the day nurse eh, tas verify. As in talaga tinatawagan namin.
Talaga?
Oo,
Oo.
tatawag talaga kami. Hoy, anong kinalat mong syringe dito?
Mm.
Balikan mo.
Sayang,
Ganon.
sayang yung gamot eh.
Oo,
Sayang yung
oo,
lalo na
diba?
kapag yung gamot mo
Oo.
eh, 13,000 isang vial, di ba?
Oo, yun na.
Oh,
Ano kasi, alam mo naman sa US, sobrang yaman nila, diba? I mean, marami silang insurance, mga ganyan.
Oo.
So,
The
totoo
medications are
din.
free. Oo.
oo. So, kumbaga, covered na ng mga ano nila. Kaya,
May
syempre,
Medicare.
we are basing on US standards. Syempre, kapag Philippine standard, syempre, kailangan i-verify mo muna sa ano bago may discard. Kasi sayang yung binayad ng pasyente na kamahal-mahal, diba? Okay, number 60. Naubos na yung boses ko. 65.
65.
When administering drug therapy to a male geriatric patient, the nurse must stay especially alert for the adverse effects. So, which factor makes geriatric patients to adverse drug effects? Anong answer po natin dito? Parang yung kanina rin, yung number 62 ata yun. So, answer is letter B, diba? Aging-related
Aging related.
physiologic, aging-related. So, this now accounts for the increased frequency of adverse drug reactions among elderly patients. Okay? So, yung mga renal and hepatic changes cause drugs to clear more slowly in this stage, yung mga geria natin. And with increasing age, neurons are lost and blood flow to the GI tract actually decreases. Nagdi-decrease, hindi nag-enhance. Okay, number 66. A female patient is being discharged after cataract surgery. After providing medication teaching, the nurse asks the patient to repeat the instructions. The nurse is performing which professional role? Remember, as a nurse, we have varied roles. Diba? We can be a nurse manager, we can be an educator, we can be a caregiver, or an advocate. Okay, so in this case, ano ang role natin dito? Okay, we are being
Educator.
yes, we are an educator. Okay? Yun nga din yung pinapas ngayon, 'di ba? Na-mention ko sa inyo na magkaroon ng nung dito sa Philippines yun na magkakaroon daw ng nurse clinic. Kasi hindi lang naman doctors ang pwedeng magkaroon ng clinic. Pwede rin daw naman sa mga nurses. Pero dito nga kasi kailangan pang i-empower. Kailangan pang i-empower talaga yung nursing profession. Parang sa ibang bansa din na talagang kapag nurse ka, 'di ba, sobrang taas din ng tingin sa iyo, very empowered kasi ang nursing profession. Dito sa Philippines, ngayon nga ng Year of the Nurse, 'di ba? Parang anong napapansin as an observation na may mga iba na mataas na yung, 'di ba, parang ngayon lang na ganitong COVID situation, ngayon lang nila mas na-appreciate yung role ng nurses. And I hope na magtuloy-tuloy yung ganong feeling of empowerment sa atin. So, the nurse acting as a manager, okay, paano siya, anong instances nangyayari yon when performing such activities such as yung scheduling, di ba? Mga head nurse, yung mga nurse manager na yon, scheduling mga duty or kaya making patient care assignments. How about for the caregiver? Okay, ito yung mga nagpo-provide ng direct care, including mga bathing the patients, administering medications, and prescribed treatments. And yung patient advocate naman, the nurse acts as a patient advocate when making the patient's wishes known to the doctor. Yun. Okay. Number 67, a scrub nurse in the operating room has which responsibility? The answer is, of course, as a scrub nurse, our main responsibility is to hand the surgical instruments to the surgeon. Okay? Positioning the patient, hindi natin ginagawa ito as a scrub nurse, yung assisting with gowning and gloving, and applying surgical blades. Usually, kaninong task itong mga to? Usually for the circulating nurse. Okay? 68. A patient is in the bathroom when the nurse enters to give a prescribed medication. So what should the nurse in charge do? Ito. Parang may ganitong question din kanina, di ba, na
Oo.
Yep.
papunta yung pasyente sa ultrasound unit. Ito naman, nasa bathroom. So, anong gagawin ng nurse? Of course, iwan yung medication sa bedside.
Nakilala ko
Joke.
ganun ang
No.
ginagawa
Okay, so,
ko eh.
answer
No.
is,
Letter C.
okay, the
Balikan
answer
ang
is
pasyente.
letter, yes, okay, that is letter C. Okay? Parang inaantok na po kasi kayo eh. Number 69. To evaluate a
Nakikinig ba ngayon?
patient for hypoxia, the physician is most likely to order which laboratory test? Hypoxia. Okay? Ang
ABG?
pinaka-best dito, yes, EBG. Okay? So, ABG analysis is the only test, okay, to evaluate gas exchange in the lungs, providing information about the patient's oxygenation status. Naalala niyo pa po yung ABG analysis natin, yung partially compensated, uncompensated, and no compensation. Naalala niyo pa yon kung paano siya i-evaluate?
Hindi na.
No!
Okay, sige. So, number
Basta
70,
pag
the nurse
normal
is
yung isang value, parang ganun ata yun eh.
Mm.
Respiratory.
Mm.
Parang ganun. May
Pag
value na normal.
PCO2, oo. Sige, mamaya ko i-discuss natin. Kaso may work si Kuya Jack ng 9 eh. 8:22 na. Number 70, the nurse uses a stethoscope to auscultate a male patient's chest. So, anong gagamitin natin? Okay? I mean, which statement about a stethoscope with a bell and diaphragm is true? Okay? Ano yung true dito? The bell detects high pitch. Diba? Sabi ko kanina, bell
Bell
low.
is low.
Or
Yeah.
wow. Okay, so diaphragm detects high pitch sounds best. Tama ba yun? The bell detects trills best. The diaphragm detects low pitch. So contrasting din ito. The answer is letter
Letter B.
B. Yes. Okay. Bell is for low pitch and diaphragm is for high pitch.
High
Okay,
pitch.
number 71. A male patient
Oh,
is to
ito,
be
hindi ko alam
discharged
to.
with a prescription for an analgesic that is a controlled substance. During discharge teaching, the nurse should explain that the patient must fill this prescription. How soon? Okay? Kailan? So, this is based on standard. So, the answer is letter C. Okay? So, an outpatient must fill, yes, within 6 months. An outpatient must fill a prescription for a controlled substance within 6 months of the date on which the prescription was written. Okay? So, yun po. Controlled naman kasi siya eh. Controlled substance naman. So, yun yung ating clue dito. Controlled naman yung substance ng medication. Number 72. Which human element considered by the nurse in charge during assessment can affect drug administration? Okay, number 72. The answer is letter D. Okay? So, the nurse must consider the patient's cognitive abilities to understand drug instructions. If not, the nurse must find a family member or significant other to take on the responsibility of administering medications in home setting. Okay, so yung patient's ability to recover, occupational hazards, and socioeconomic status do not actually affect drug administration. Diba? Parang ano namang magagawa. Okay? 73. An employer establishes a physical exercise area in the workplace and encourages all employees to use it. This is an example of which level of health promotion. Nalala niyo itong discussion natin. So, this is an example of
Primary?
a primary
prevention.
primary prevention. Okay, since this precedes disease and applies to health patients, how about yung ating secondary prevention? Kung maalala po ninyo, this focuses on patients who have health problems and are at
Already have
risk
that.
for developing complications. Yung tertiary naman natin, this enables patients to gain health from other activities without doing anything they themselves. So this tertiary prevention um, ano to? Enables patients to gain health from other activities. 74, what does the nurse in charge do when making a surgical bed? Yan. 74, the answer is letter letter A. Okay? So always remember, when making a surgical bed, we should leave the bed in a high position when finished. So after placing the top linens, diba, kung maalala nyo yun, top linens on the bed without touching them, the nurse fan folds these linens to the side opposite from where the patient will enter and places the pillow on the bedside chair. Yan. So all these actions promote transfer of the post-operative patient from the stretcher to the bed. And when making naalala niyo pa po yung ating bed making? When making an occupied bed or unoccupied bed, the nurse places the pillow, saan natin nilalagay? Sa head of the bed, okay? And tucks the top sheet and blanket under the bottom of the bed, okay? Kapag naman po occupied bed, anong ginagawa natin? We are rolling the patient to the far side of the bed, papunta dun sa gitna. Okay? And last number, which action is essential when providing continuous enteral feeding? Okay, our answer here is letter A. Okay, always remember po, elevating the head of the bed during enteral feeding minimizes the risk of what? Aspiration. Okay? And of course, this will allow the formula to flow in the patient's intestine. So, dapat naka-elevate po yung head ng bed para ma-prevent yung aspiration and para mas maganda yung flow ng formula feeding or yung formula sa ating sa intestine ng pasyente. Okay? When such elevation is contraindicated, ano naman po ang magiging position? Position the patient on the right side. Okay? So the nurse should give enteral feeding at room temperature. Okay? Para ma-minimize po yung GI distress. Okay? So to limit microbial growth, anong gagawin natin? The nurse should hang only the amount of formula that can be infused in 3 hours. Okay? Para po ma-lessen yung yung pag-increase or pagkakaroon ng mga microbial or microorganisms dun sa ating formula. Okay, so we're done with that. Ayan. So, i-retake po ninyo ha. I-retake ninyo yung question 1
Paano
to
yung
75. And then
tinake
I
ko na
will be
kasi siya
posting.
kanina.
Niretake
Take
na
ko
po.
ulit.
Okay.
Oo, kasi nakuha ko nung sinend mo.
Okay po. Sige. So, wait lang. I-check ko lang. Yung retake.
So, si Jax lang po magre-retake dito, which is unfair. Kasi he'll get a perfect score.
Wala.
Unless he's not listening half of the time.
Ba't may violent reaction to? Diba? Ako naman kasi, habang walang instruction, hindi ko gagawin, di ba? Di ba? Diba?
Dude, this is what you call initiative.
Diba pag may exams, dapat follow instruction? Kasi kunwari IELTS or NCLEX yan eh. You don't start the exam until told to by the proctor.
Sige, pwede naman po maggawa ulit ako ng another G-form. So, para i-retake niyo pong lahat. Kung gusto niyo i-retake. Para lang i-assess kung naintindihan niyo ba. Or dapat perfect na, no? Dapat 75 over 75 na. Ayun.
Perfect or zero.
So, perfect.
Yeah, I'll take it right after para matandaan ko lahat.
Ayan. So, i-present ko po sana itong ABG analysis pero wait lang. Kasi wala na atang time, no? Kuya Jack? May work ka ata.
Hindi, may work ako pero pwede ko namang isingit yan. Kasi ang meeting ko pa naman sa client ko mga 10:15 pa. So, I can still may ba?
Okay, so pwede pa.
Sige lang.
Actually, this lecture ko din to sa estudyante. May prayer pa. Wait lang ah. Okay, so quick lang po ito. Our ABG studies measures